So a bit of an introduction. My name's Agnes Becker, and I'm the Targeted Communications Manager at the Mental Health Innovation Network based at the London School of Hygiene and Tropical Medicine. So this session will be trying to inspire you to use communications to influence policy. The Toolkit is basically a download of hopefully my brain and many others at the school into one very concise document. I wanted to ask how many of the projects had communications officers as part of your core team. Great, a couple, brilliant. So I'm hoping that this toolkit will be a kind of shortcut to a communications officer. If you've got someone in your team who's particularly excited about communications, this toolkit will hopefully help them to produce a plan and various different products for your project. So what is research communications? It's very broad, and I think lots of different groups call it various different things. It's been known as research uptake, sometimes policy influence, and other guises. But it's about changing behavior. It's this dialogue and conversation which is being brought up quite a few times in the last couple of days, I think. It's about generating action and working with your stakeholders in your project. It can be used for policy, but it also be used for your implementation. And the key thing is that it should start at the beginning, right at the start when you're thinking about your research questions and your innovations. And this has come up multiple times. Engage your stakeholders right at the start of your project. And then use communications all the way through to the end. The toolkit follows on from the Global Mental Health Policy Influence Toolkit, which was written by the Overseas Development Institute and launched in Toronto in the summer. At the end of their toolkit, they talk about how communications activities are one of the most important types of actions you can take to influence policy. So I wanted to underline that the communications toolkit follows on directly from that policy influence toolkit. And if you have completed some of those tools in the policy influence toolkit, the communications toolkit will run on straight from those activities, and you can use what you've done in that toolkit to populate the work plan for communications, which I'll come on to in a second. You can download it from our resources section, which is what Fahmi was talking about earlier on the Mental Health Innovation Network. It's one of the most recent tools there. And you can download the PDFs on the side. And we'll hopefully have a whole load of other connected resources with that, upload this podcast, and maybe some webinars as well. So what's inside the toolkit? This is an exclusive preview for you guys. We just soft launched it last week. It's going to be on the site for a couple of weeks, and we really encourage you to take a look at it and give me feedback on what we could do to make it a bit more relevant, or improve it, or give better examples. There's 6 tools and a set of guiding principles. So the guiding principles we'll look at in the second half of this session, about packaging your key messages and getting to stick in the minds of your audiences. And then we've got a communications work plan with a template. And I'll go into that a bit more towards the end of this first half. The rest of the tools 2 to 6, I'll whiz through first. The perfect communications product checklist. The reason I put this up there is because I frequently produce products like this one with my colleagues, researchers at the London School. And there were a set of things that I kept thinking through every time I was producing one of these products. So I've condensed them into a set of questions, which hopefully will help you produce the perfect communications product. It's things like, have I put my key messages right at the top? In research articles, journal articles, we often put them right at the bottom in the conclusion. But for communications messages, where you want to get your key message to your stakeholder as quickly as possible, right at the top. So we've done this, and this is a research brief that I produced with my maternal and newborn health team at the London School. Key messages are right at the top. We've got some nice photos, so making sure the photos are of high quality if you're going to print them, or of low quality if they're going to be in online. Thinking about the design, thinking about how you edit the document, making sure that you've copy edited so that all of your key messages are really streamlined and obvious in your document. Using layperson's language, so what does that mean? This is language that perhaps your friend or your mum could understand. It's talking to people who might not have that institutional knowledge that you have. For example, being new to the field, I have no idea what psychosocial treatment means. But to all of you guys, it probably means something in your head. So it's making sure that your language speaks to people who don't have that kind of technical background. So the checklist will take you through all these different steps and make sure you have your perfect product. The one thing that I wish we had done with this product is think a bit more about the aim. We often think about, we must write a policy brief, or we must write a blog, without thinking exactly why we're doing it. And I'm hoping the toolkit will help us all to think a bit more about, okay, if we're going to produce a product and we've got limited time, limited resources, let's make sure it's the right one for our team and our project. And this aim is one way to do that. So it's basically you plug in your sentences or your words for your product. I've done it for the presentation here. So this presentation is for global mental health innovators to inspire you to use communications to achieve your project objectives to scale up your innovations. And linking it back to one of your project objectives. So this is one of MHIN's objectives to support the scale up of innovations. So hopefully this aim will help you to target your products as best as possible. Tool 3 is how to write an impact summary. These are basically 3 bullet points about the impact of your project, and usually done towards the end once you've got an evaluation. Things about the coverage, the number of people who are screened, for example, an outcome, the number of people who receive treatment, or the cost or cost effectiveness. And they're 3 really short bullet points about your impact. And once you've got those 3 key messages sorted, you can use them for various other products, like policy briefs, a pitch to stakeholders, your project website, or even send them to us at MHIN, and we'll put them on our website on the innovation summaries. The 4th tool is a blog. In this toolkit, we've put together a few tips that I've learned over my time writing blogs. Blogs are a great way to get your work out really quickly. Research articles take a long time. One in my current maternal health project has taken about, I think, a year to get published. So if you want your work to get out there quickly, a blog is a great way of doing that. And you can respond to global issues or news stories that are coming up. So, for example, Fahmi showed a few blogs responding to the Ebola crisis and how mental health is being linked into the building back better for Ebola. Tool 5 is an infographic. Infographics are a great way to tell stories visually. And being public health researchers, we have a lot of data, and infographics are a great way to use your data to tell those visual stories. Humans are visual creatures. We take in a lot more through a picture. For example, if you read 5 o'clock, you're reading it sequentially, 5 o'clock. But you just look at one picture of a clock and you can digest that in one go. I've got a great example of that recently. I was working, again, for the maternal health group. Apologies, I've only been with mental health for 4 months, so that's where most of my examples are from my previous project. This was a table that was put together for a meeting similar to this one. It was a gathering of all the Gates-funded maternal and newborn health projects. And we were asked to give an overview of the context of the 3 countries we were working in, Ethiopia, Nigeria, and India. And this is what my colleague Christina came up with. We could talk through this slide in all the different lines, but we thought it might be interesting to try and do an infographic. And we came up with something like this. There's various other bits to the slides. So in the previous slide, you could see these newborn and under 5 child deaths. But just looking at the numbers, you couldn't pick out the patterns very quickly. Whereas here, you can see the large blocks are the under 5 child deaths. And in Nigeria, it's still quite bad in comparison to Ethiopia and Uttar Pradesh. However, although Uttar Pradesh and Ethiopia have managed to reduce the under 5 child deaths, you can see the proportion of newborn, which are slightly darker ones, is still the same. So the proportion of newborn deaths haven't been tackled in the same way as the under 5 child deaths. So you can start to see patterns that you might not see just looking at a chart. And the toolkit lists various different tips of how to produce infographics. There's a lot of playing around when you produce an infographic, but there are plenty of free tools as well that you can use, and the toolkit talks about those, as well as a chart selector to help you decide which is the best chart for your data. or the message you're trying to get across. Next tool is a policy brief. So for the toolkit, we've honed down on just one type of policy brief. This is, we thought, most relevant for your project. It's about how to put together recommendations based on the evidence for your project, rather than an internal memo from inside a Ministry of Health, for example. And these are great ways to get, they're concise documents, they're 2 to 8 pages, so it's quite challenging to try and condense everything to that amount of words, with a structured argument which give clear evidence for your recommendations. I wondered how many people have produced a policy brief before for their projects? A few. How long did it take? I'm going to pick on you, Smoocher. How long did it take to? A long time, yeah. It's hard condensing things down to a couple of pages. So we're hoping with this toolkit, we've produced a template where you can just literally plug in the sections that you need for your policy brief. I'm hoping that will help you to speed up that lengthy process. Going in reverse order, back to tool 1. The work plan. The reason I've left this till last is because I think it's really important to do as the first thing before you start going through all your products. The work plan will help your team to think through your communications work in a way that maximizes limited resources, targets your stakeholders' needs, and hopefully inspires them into action. By working through what your objective is, who your stakeholders are, what your key messages are, you can map out exactly what methods and communications methods and activities you're going to use that link to your stakeholder and link to your objective, rather than thinking, oh, I'm going to use Twitter, and you start your Twitter account, you start tweeting, but then you realize none of your stakeholders are on Twitter, so obviously maybe it would have been better to use a different technique or a different method. It's not very sexy. It's basically a spreadsheet which details all those different sections I was just talking about. At the top, in the orange row, is where you write your policy objective or your communications objective. So policy objective would be something where you're trying to influence policy. A communications objective might be something for your implementation of your project. An example we've got here, which is very generic: get the Minister for Health to fund community-trained lay worker innovations like ours. So this might be like the Friendship Bench, Dixon's Friendship Bench, or any number of innovations. So who's your target stakeholder? Minister for Health. And when you're thinking about stakeholders, it's best to be as specific as possible. This is where the toolkit links very closely to the Policy Influence Toolkit. If you've done the Policy Influence Toolkit, you would have thought through your stakeholders already. You would have thought through their interest and alignment, which is the next section. You would have thought through the desired behaviour change you want to see from that stakeholder in order to achieve your objective. So if you've done that, you can literally just plug it all in to this spreadsheet. Interest and alignment. Interest is a bit more full-on than alignment. So interest is where they put, your stakeholders put money towards it. They're speaking about the issue that you're trying to get the minister to fund, say a friendship bench. Alignment is whether the stakeholders likely to agree with what you're doing in your project and they share the same sense of its importance. So, for example, we might say Minister for Health. Alignment might be middling. The government health priority is maternal health, but they recognise that mental health is important. Interest is low. There's no resources committed to mental health at the moment. The minister doesn't speak openly about it. There's no sense of urgency to change mental health services. Desired behaviour change. You can break this down into things you'd expect to see, like to see, love to see. And this links back to the Policy Influence Toolkit. Expect to see. You'd like the minister to come and speak at an annual mental health meeting in your country, for example. You'd like to see them request information about how to improve mental health in the country. You'd love to see them starting to allocate funds towards improving mental health. The next column is about their information needs, and we talked about this a little bit yesterday. So thinking about your stakeholders and why should they listen to what you're trying to tell them? What's in it for them, I guess? The priority for the government is maternal health. They'd want to know how mental health and maternal health are linked, so that if that's what you were trying to do, get mental health to be funded, if you link it with maternal health, that's their priority. That's what their information needs are. Hopefully you'll get them to listen. So your key messages to meet those information needs might be mental health is linked to maternal health via maternal depression. And there's demand from the community for maternal depression to be sorted out. So this comes on to now the communications methods. There's various different methods you can use, but they can range from meetings, from products like we've got in the toolkit, blogs, policy briefs, through to presenting at conferences. And in the toolkit, we've got a whole range of suggested methods that you might want to think about. So to try and generate demand from the community or demonstrate demand from the community, you might want to launch a media campaign to raise awareness of how mental health can be tackled using community training, which maternal health already uses. And you might want to launch that campaign in time for World Mental Health Day, for example, using a hook to get your message out. The activities column, fill that in if it's useful to you. For all of this, fill it in if it's useful to you. You don't have to do every single section. The activities just break down the method a little bit more. So you might want to contact journalists. You might want to produce an infographic showing the burden of disease for maternal depression. You might want to write news stories of case studies of women with maternal depression who benefited from community lay worker interventions or innovations. The lead is identifying someone in your project, which might be a press officer or it might be someone else, who would take those tasks forward. This is getting into a bit of project management now. And then the timeline at the end is for you to plan when you're going to do your activities. So if you have got an event that's coming up, that might be in December, say, you'd want 2 weeks before to have made sure you've sent out all your package of agenda, participants lists or whatever. 2 weeks before that, you might have had to make sure you've invited all your delegates. So this is a kind of a quick and dirty way of pulling together all of the different components of a communication strategy into one spreadsheet. So I'm hoping that was a useful session for you guys. The toolkit is uploaded on the network website. We'd love you to take a look and to let us know if it's useful, if there's anything else we could do to try and make it more accessible. And thank you very much for listening. So a bit of an introduction. My name's Agnes Becker.